Welcome to the Transfusion Medicine Data Portal Support Video Series. These videos have been developed to support British Columbia's transfusion medicine staff and stakeholders in accessing and analyzing their transfusion medicine data from BC's Central Transfusion Registry. This video reviews the report types and the content and purpose of the Transfusion Medicine Data Portal CTR reports. To access the reports once you are logged in to the Transfusion Medicine Data Portal, select the CTR Reports tab. Here you will find a list of 18 prepared reports under 4 categories. We'll review each category and a brief bit of information about each report underneath. First is the Component and PPP Utilization Reports. These include the alternate ABO reports that are available quarterly or on a fiscal year basis. Each of these reports break down to the facility level information regarding the recipient blood group for a particular blood group of red cells or platelets and compare the current quarter to the previous quarter or current fiscal year to the previous fiscal year. For example, you might run this report for O-negative red blood cells to show you the number of O-negative red cells that were transfused to O-positive patients and A-positive patients and O-negative patients. Next is the disposition of all blood products by facility summary. This provides a summary of all products and their final disposition, whether they were transfused, expired, discarded, or shipped, and breaks this down month by month. Lastly is the Rbc Utilization Report, and this describes the red cell transfusions, expiries, discards, and ships for each blood group at each facility in the selected time frame. The next cluster of reports are summarized as the IG reports, or immune globulin. Within this set of reports, there are 2 main types. The first is the IVIG and SCIG utilization data that provides a quarterly or annual trend to show the total grams of IVIG and SCIG per quarter or year, the estimated cost, the grams per health authority population, and the change in grams, in cost, and in grams per population from the preceding quarter or year. A trend graph is also included on the final page of this report. The IVIG or SCIG utilization summary by condition summarizes the transfusions of IVIG or SCIG by condition, or the indication for transfusion, along with the number of recipients and the number of grams discarded or expired. These reports are available at a health authority or provincial level as well. The third group are the redistribution reports, and they are available for both factor redistribution and RBC receiver sites. The factor redistribution and utilization report describes the quantities of factor product transfused, expired, discarded, and shipped at each facility in your health authority. RBC receiver site redistribution reports are available for health authorities who have a designated receiver site and are run for that specific receiver site. It describes the detailed number of units they received by blood group from each shipping facility. The last group of reports is the TIS reports. This stands for Transfusion Transmitted Injuries Surveillance System and reflects the transfusion reaction reports that are submitted to the BC Provincial Blood Coordinating Office as part of the office's role in supporting the reporting of transfusion reactions to the Public Health Agency of Canada. This set of reports follows a different reporting time frame than the remaining utilization reports, and this is reflected in the data considerations block. In this test system, these reports are complete through May 31st, 2009. You'll see the TIS reporting data is updated through March 31st, 2009. This reflects the 6-month after the close of a quarter. That is the reporting deadline to the Public Health Agency of Canada. More information on these specific date ranges and reporting timeframes is provided in the Frequently Asked Questions document. Under these reports, we have an available case listing for the health authority. This provides a abbreviated summary of each case that was submitted to the Provincial Blood Coordinating Office. These are non-identifiable in the report, but gives you an idea of the number and types of cases that were provided. The quarterly summary report and yearly summary reports provide a rate of reaction and number of recipients involved in each type of transfusion reaction for components and separately for plasma protein products. Lastly, the reaction attributes provides a series of pie charts around where the reactions occurred, which area of the facility, what categories those reactions were clustered under, and information around the days of the week and time. Together, these reports provide a structured, more detailed view of the data from the Central Transfusion Registry than you would see in the dashboard. They allow for easier comparison of consistent information quarter to quarter and year to year. For more information about the CTR reports, including a full description of each report, see Section 7 of the Transfusion Medicine Data Portal Manual. Visit the PBCO website for additional information or email the data portal to obtain user access forms, request training, or share any considerations or feedback. The most effective way to learn about the reports is simply to run them. And that's what we'll cover next in Video 6, Reports, Functions, and Features.